This is Jerry Hesch at Hesch Institute in Aurora, Colorado. And my client drove 6 hours for treatment. He's from Butte?
Crested Butte.
Crested Butte.
Yeah.
Colorado, yes. As a child, he fractured his tibia. There was a significant displacement. And ever since that, his right foot has pointed outward somewhat. When I check his hip rotation, he has a generous amount of hip rotation, and there is a soft end feel to that. So stretching is not going to change that. How old were you?
Maybe 10.
Maybe 10 years old. So his body developed in response to that injury, and it could be that your hip just developed a little bit differently than the other side. You did have therapy trying to address that, correct?
Well, we tried that last year.
Uh-huh.
But it was inconclusive in the end
in
terms of helping it out.
Yeah. Well, this, I'm going to refer back to this a little bit later on. He points to his left PSIS, and in supine, his legs appear even. His pelvis is higher on the left side. That's not subtle. He has good mobility when I spring the pelvis posteriorly on either side, and when I create left and right side glide of the pelvis, it moves very nicely. Let's have you lie on your stomach. What I find is that he's a little bit lower on the left iliac shelf, and I can spring him into anterior rotation on the right. On the left, there's no movement. The ischial tuberosity is lower on the left. I can create vertical mobility I can create vertical mobility through that right half of the pelvis, but when I try here, there's no movement. I'm not able to take up any slack. I'm doubling the force. I'm not able to get any spring mobility. So we call this a left posterior ilium. And the old theory is that the ilium rotated on the sacrum and got stuck. If that were true, then we would find asymmetry at the pubic joint. Go ahead and line your back again. So I'm at the very top of the pubic bones, and then I'm walking down on the front of them, and he is symmetrical all the way down. There's no asymmetry there. And I believe that a posterior ilium is a twist of the entire pelvis, but it still creates tension and reduced motion through the left ilium. So it acts perhaps as though the SI joint is stuck. Motion does not translate through that joint, but it's from an external source. It's from the whole pelvis being twisted three-dimensionally. So I'm going to go ahead and treat that now. I did look for a compensation. And if you have an acquired twist in your body, such as through injury, then somewhere higher up in your body, you're going to twist the other direction. And with a left posterior ilium, basically the lower body tends to orient left, okay? And usually the site of compensation is up in the upper cervical at C1. Usually there's a right rotation of C1. You're fine. You have beautiful mobility in the upper cervical. So I think that you already had the compensation built in with this externally rotated right hip. So that's just a thought. Anyway, let's have you lie on your right side facing me. And then I'm going to bend the top leg. I'm going to bend the hip up to 90 degrees. And I'm going to check the camera angle. So males tend to be a little tighter in their hips than females. And what I do is palpate that PSIS, and I palpate just medial to it, but you have really flexible hips, so I'm able to bend you up to 90 degrees. What I don't want to do is take you further, all the way up here. You're so flexible. Now I feel tension in those SI ligaments. So it's very appropriate for me to treat you at 90 degrees of hip flexion, because you don't tend to rotate the pelvis backwards any further at 90 degrees. Oftentimes I'll treat a male at about 60 degrees, but in this case you're quite flexible. So your thigh is parallel to the floor. I'm pulling your right ilium forward, and I'm pushing into your thigh with my stomach. And I keep my elbow straight, and I just do little tiny oscillations. I can't even see them. I can feel them, but I can't see them. So I do 30 of these. Good. Lie on your stomach. I did screen his lumbar spine, and I did not find any rotational pattern at L5. These look more symmetrical. I can now take up the slack in forward rotation on the left side of his pelvis, and I can spring it, and now we have translation of movement through the SI joint, through the lumbar spine and hip. And now when I come underneath it, I can now push up and take up the slack in the body, and after that I can spring it. So that motion is certainly improved. Do you want to walk down the hall and back and let me know how you feel?
Sure.
Oh, and bending backwards increase your pain, so let's have you bend backwards also, okay?
Yeah, this was absolutely impossible this morning. It does pinch right now a little bit on
Okay.
that same exact spot where I had points
Okay.
before. So that spot right there is definitely...
So at end range you feel a slight pinch.
Yep.
Okay.
And that's really like...
All right, so
Yes.
let me do one more test. I didn't do a lateral spring test, okay? The lateral mobility is good. Lay on your right side, and then put your legs straight. Nice, and then lean forward a little bit right there. So I'm testing anterior compression, and you have good mobility there, okay? And you have good mobility in the back, so there's not a medial, posteromedial or anteromedial restriction of mobility. Anyway, walk down the hall and tell us how you feel.
Okay. Interesting you got that to move. The left leg feels more free.
Does it? So left leg feels free?
More free. Yeah, going
Good.
forward.
Anything else that you feel?
I'm walking. I'm not stooping.
Uh-huh, uh-huh. So come sit in this chair and see if you feel any difference in sitting. Should have had you sit before I treated it.
Well, I was sitting in the car for 6 hours, yeah.
Yeah?
And that seat in the Honda is really perfect for me, and that cradling and not stretching during that time makes a big difference
Uh-huh.
in terms of not stretching it all the time. Because when I'm hurting in the morning, I tend to stretch it. Middle
Okay.
of the night waking up because I can't sleep, because laying down there's no position that
I
feels
see.
good. And the pain was severe this morning, as indicated on the questionnaire.
Yeah, yeah.
And sitting in the car for that time in that position
Yeah.
cradles it and relieves that stress on the joint.
Uh-huh.
And what I perceive as that pain and that inflammation, what I think is inflammation that might not be, dissipates even
Okay.
in as fast
Alrighty.
as 2-3 hours. So
Okay.
I was comfortable on the drive.
Yeah.
And I was a little afraid that coming in, I was like, well, I've really
You thought
nothing
you
to
would be
show.
fine. So, well, we did find something.
But at
But-
least you found that.
Yeah. So in sitting, you can't tell if there's a difference. You can't tell that maybe your pelvis is straighter.
Yeah. I mean, I can sit and I'm comfortable, so you must have done something right.
Very
You found
good.
something.
Very good. So I'll teach you a self-treatment to stretch the soft tissues. And I'll just go ahead and lay on this bed and demonstrate it to you.
Okay.
And you're not going to need to come back and see me. I want to see you once. I want to see you tomorrow morning, okay? And we'll see if the pattern changed at all. Sometimes the pelvis does that. Sometimes it turns into a different pattern, and you just follow it and treat the next permutation. I doubt it'll do that, but just in case, I'll still see you again tomorrow. But you'll be able to self-manage this, okay?
I might be a different person tomorrow morning.
Could be.
Hopefully not.
We'll see.
If I'm like this morning,
All right.
I see a different guy.
But the self-treatment is done on the side of your bed, okay? And on this table, I'm going to sit on the left side of the table. So you just sit down on the bed, bring your feet up, and then scoot your right leg over, and then scoot your pelvis over a little bit for comfort. Then bring the left leg over, scoot it more if you need. All I'm doing is dropping the left knee. The knee is bent 90 degrees, and the hip is just dropping down. And I keep the knee pulled in about 20 degrees. And you do this for 2 minutes, and it stretches all the soft tissue that would tend to twist the pelvis posteriorly.
Okay.
Okay, so I'll have you practice this, and I'll give you a picture of it as well. And that's the self-treatment for a posterior ilium. Okay? Anyway, I'll stop filming now, and I'll look again at your low back. I don't think I'm going to find anything there, but I'm going to look one more time.
Okay. When I twist like this, it clunks.
Okay? Alrighty.
So I might sit there and have you maybe put your hand on me and see
Sounds good.
what the situation is with that. It's very odd.